To the first woman in Niagara County to be infected by the Zika virus.
I didn't know anything about it. When I came back, it was all over the news.
This is the second case of the Zika virus in western New York. Back in February, there was one in Erie County. And now this week, a woman that was on a mission to help people in a third world country has been hit with the infection. 7 Eyewitness News reporter Rachel Elzafan shares her story.
I was helping out in a children's home, an orphanage. I sponsor a child and I went to go meet him, and I was just helping out any way I could.
A January trip hundreds of miles away to help others in Haiti has turned into quite the hassle for this woman who wants to remain anonymous.
They told us that chikungunya and Zika were going around, but it wasn't anything in the U.S. that we were worried about. I didn't know anything about the birth defects or anything until I got back.
While in Haiti, news broke that the mosquito-borne illness was spreading in Central America and the Caribbean. It was also connected with a surge of birth defects causing brain abnormalities.
I wore bug spray every day, but I got about 30 mosquito bites anyway.
Shortly after returning, she started showing symptoms.
He said not to get pregnant for the time being. They started testing me. I had 3 rounds of blood work, and this is why it's taken so long to get a diagnosis. That's why it's taken 3 months to get the diagnosis.
Both the health department and the woman emphasize the public is not in danger. Mosquitoes that carry the virus are not even in western New York. Zika can only be contracted from the insect or by being intimate with someone who has the virus.
I don't have the virus in me, so I just have the antibodies, so being around me is not an issue.
As of April 13th, 358 people in the U.S. were diagnosed with Zika. Every single one of those had either traveled to the outbreak region or it was sexually transmitted by a traveler. The federal government now wants to find ways to prevent the virus.
The emphasis has to be on a vaccine. So a woman never contracts Zika even if they're bitten by the wrong mosquito. So the Zika virus is passed by a certain mosquito, and there are thoughts of ways to obliterate that particular mosquito population, and we're looking at that because that would be the root cause of the virus.
But this woman still plans on doing mission work in the Caribbean.
I'm planning on going back over the summer, so yeah, I'm not afraid.
Health officials want us to emphasize the Zika virus is not a public health crisis here in western New York or anywhere in the United States. If you are concerned about any regions, though, we do have on our website information about the areas that are affected by the Zika outbreak. In North Tonawanda, Rachel Elzafan, 7 Eyewitness News.